엉덩이 뒤로 빠져있고, 무릎 안 펴지고. 자, 걸으세요, 걸으세요. 무릎 안 펴지고, 엉덩이 뒤로 빠져있고, 가슴 앞으로 나와있고, 그럼 저기 하려고 진짜 아프지. 아니야, 기도 없어. 뭘 보는 거냐면은, 가만히 낚시 다리 같이 보세요. 여기가 올라가고 여기가 내려갔죠. 자, 여기가 올라갔고 여기가 내려갔어요. 이쪽 다리가 짧아진 거야. 오른쪽 다리가. 오른쪽 다리가 짧아졌기 때문에 오른쪽 다리 끄집어내줘야 되고 이 제일 중요한 게 오른쪽 다리 끄집어내는 거예요. 그러면 허리 아픈 곳은 다 사라집니다. 이것이 시간이 흘러가면 흘러갈수록 허리 무릎이 무진장 아파져요. 지금 보이시나요? 여기가 짧고 여기가 긴 거. 네. 이 길이만큼 한 1cm 정도 돼요. 이게. 이 길이만큼 오른쪽 다리가 골반이 지금 안으로 밀려 들어간 거예요. 요거 빼주면 돼. 네, 됐습니다. 앉으세요. 보기 좋으세요?
나중에 저거 다 했어 그러지 마세요.
Hi, my name is I'm Dr. Park. Today we have what is your name? Helen. Helen, how old are you? Okay. Helen is 32, and she has what is your main complaint? Okay, she has lupus. And are you having any pain or any ache? Okay, where do you have pain or ache?
My back.
Okay, low back. Okay. Yes. So how long have you, Helen? So how long have you had lupus? 16 years. Okay. Are you doing anything for it right now? Are you taking medication? Okay. And now the low back pain. How long has that been? Couple of years. Okay. So the low back, is that bothering you the most lately?
No.
Okay. What's bothering you the most?
Lupus.
Okay. So do you have butterfly rash?
Yeah.
Okay. Okay. Joint pain? Okay. What other joints do you have pain?
Right now,
Yes, or in general?
my fingers.
Your fingers, okay. So you have pain in your low back. Do you have any pain in your knee?
Not really.
Okay. So the main area is low back and the fingers.
Right now, my tailbone.
Tailbone also, okay.
Just right now.
Okay. And how about restroom? Okay. Do you have, how often do you go to the bathroom at night?
I don't go.
Okay. Do you sleep through the night usually? Okay. And anything else?
Proteinuria. I have
Oh,
protein.
oh, okay. So, okay, I see. So you have kidney. So she has. Helen is saying she has kidney issues. She has proteinuria. Proteinuria is when protein leaks out to the urine. So that means she has some kidney issues. How long have you had proteinuria? How long have you had protein in the urine?
About 13
Okay, 13 years. And have you had kidney tests done? Okay. What did the doctor say? Okay. Did they tell you what stage kidney disease? Stage 4. Okay. So stage 4 kidney disease. Do you know what? Did the doctor say anything about stage 4 kidney disease?
Just take medicine.
Okay. Yes. Do you know what stage you start doing dialysis?
When you lose the function.
Yes. So stage 4 means your function has decreased considerably, right? Yes. So did the doctor say you're getting close to where you need to get dialysis?
No.
Okay.
I have ringing in the ears.
Okay. And you also have ringing in the ears. Okay. Left ear. Okay.
왜 젊은 날에 이런 거지?
So Helen. Okay. Okay. How long has the earring or the tinnitus been in the left ear? How long has that been?
15 years.
15 years, okay. Okay, so just the left. Okay, do you feel it right now?
Yeah.
Okay. Is it mild, moderate, or high?
Medium.
Okay, well, moderate. Okay. Okay. So right now you have the ear ringing, and then you have the finger. A little bit of, is it achy or stiff?
No, right now I'm okay. My
Just the
elbow,
tailbone?
my
Okay.
back is hurting. My hips.
Okay. Okay. So Helen currently has, right now, she has ear ringing on the left, and she has hip pain and tailbone pain. Okay. So we're going to use points on your hand, on your foot, maybe some on the face, and some around the leg to treat each problem. Okay. Okay.
한국말로 자 설명 한번 해주세요. 뭐가 있나요?
예. 헬렌 이분은 32살이고요. 루푸스라는 자가면역 질환을 앓고 있습니다.
루푸스.
예. 그래서 이게 16년 전에 진단이 돼서 그동안 계속 약을 복용했었고요. 현재 통증 같은 경우는 허리가 아프거나 힙이 아프거나 무릎이 아프시거나 손가락 관절이 아프시거나 꼬리뼈가 아프십니다. 지금 현재는 꼬리뼈와 히프가 아프다고 합니다. 그리고 현재 신장 기능이 이상이 있어서 소변에 단백질이 나오는 단백뇨를 가지고 계십니다. 예, 그게 13년 되셨다고 합니다. 예, 그리고 신장 문제가 있는데 그 1단계부터 쭉 있는데 지금 현재 4단계라고 하십니다. 예, 그렇습니다. 그래서 이용해서 치료를 해보겠습니다. 또 눈이 이렇게 사물을 쳐다볼 때 뿌옇게 보이신답니다. 네. So based on her presenting symptoms, her diagnosis for us is that her kidney and bladder function is very low. So what we're going to do is we're going to use points, mainly on the foot, that will target the kidney, the bladder, and the ureter to help with these problems. If we are successful in treating this area, many of the problems that she's having, such as the ear ringing, tinnitus, low back, hip pain, tailbone pain, joint pain in the hand, even protein in the urine will improve.
지금 이게
So we're going to use Moon tip. So these tips are made of silicone and rare earth metal with some platinum and different metal elements. So what they will do is they will apply pressure on points on the body, which are acupuncture points, and by using these tips and applying pressure, we can get same results as using acupuncture needles. So we have this type, this is a 1 unit type, and we also have a 7 unit type, which looks like a flower. So we're going to start off by using a point called 삼음교. This point is spleen 6. It's a few inches up the inner side of the leg. So you place the tip just like this using a sports tape, and I'm going to stimulate using my thumb. As you can see, the area may be a little bit tender, but what we're doing is we're stimulating the point, and by doing this, we're firing the peripheral nerve, which will send signals to the brain and trigger a response in the brain to release chemicals such as enkephalins or endorphins to help decrease pain signals and increase blood flow. Okay, is it sensitive? Is it a little bit tender or painful? Painful? Okay. Usually this region becomes very tender or painful if you have issues around the bladder or the uterus or any kind of female issues.
오른쪽은 덜 아프고 왼쪽이 아픈 거죠? 네.
Which side hurts more, left or right? Or both?
That's this one, little more.
Okay.
자, 이 상태에서 이제 들어가시는 거예요.
기본. Okay. Okay. So we're going to use another 1 unit, and I'm going to use Taechung, liver 3. Taechung, liver 3 is located in between the big toe and the second toe. You follow the point. There's a depression. If you keep following, there will be a point where the depression ends. So this is liver 3. Again, I'm going to use my thumb to press on this point. And you can always ask the patient if the area is painful or tender. Okay. Is it sensitive or painful? No? Okay. If the patient doesn't feel much pain, you can always press to a different direction. You can push a little bit towards the big toe or a little bit towards the second toe. You can press a little bit towards the body or towards the tip. Okay. Painful here? No? Anything here? Okay. Okay. Now I'm going to use the 7 unit, the flower, on point here. This one is called Yongcheon, or kidney 1. So how you can find this point is you follow the depression. There's a valley that meets about on the lower border of the middle of the third toe. So this is where it would be here. Okay. So again, I'm going to use my thumb to apply pressure. And while I'm applying pressure, you can always use your index or middle finger to apply pressure on liver 3 as well. Okay. And I'm going to, this is another point on the inside of your foot. This point here is called bladder. Okay, and since Helen is having hip pain and tailbone pain, I'm going to use a point called Moon's number 1 point. Now this point is located along the border of the heel. You will follow down from the middle of the little toe. Follow it all the way down, and you go inside about ½ inch. Okay, so this is where the ridge is. You go in about ½ inch. So now I'm continuously, I'm applying pressure on kidney 1, Moon's number 1 point, and on the top, liver 3. Okay. Now I'm going to use the flat one. Okay. This chip I'm going to be using from kidney 1 and then connect it to the bladder point. So this point is called the ureter, 수뇨관. So I'll be using, so you just connect from kidney 1 Yongcheon to bladder. So this is what it looks like. on the other foot. Okay, so now I'm going to use a 1 unit on tailbone point.
테일본 폰.
테일본이라고 할까요? 아니면 생식기라고 할까요?
테일본 괜찮습니다.
네.
테일본.
그 밑에 꼬리 쪽으로 할까요? 예. So the tailbone point from the tip you go up a little bit. Okay? It's about here.
이거 꽉 누르고.
And I'm going to press firmly on the tailbone point.
자동차 이거는 그렇게 해놓고. 내 손톱 맞았어. 오, 아파.
You can also use a mug to apply even more pressure by hitting the tailbone point. So like this, you can hold any area, blunt area, and I'm going to apply force on this tailbone point, like this.
자, 이제 꼬리뼈 앞으로 파고 아파요? 남아있어요? 아까가 10개였으면 지금 몇 개 남아있어?
일곱 개.
처음에 여기 왔을 때 10개였어. 지금은
세븐.
7, 6개가 남아있어. 죽었다 이제. 꺼.
아, 그냥 있는 대로 하셔야 돼요.
이게 사실은 걸어주면 더 좋은데 걷지를 않고 이렇게 앉아 있었기 때문에 이게 자, 네, 아니 지금 아니 양쪽 좀 걸으면서 걸어 갔다 와요. 자, 다시 한번 일어났다가 앉으시고 앉으세요. 많이는 안 하겠어요. 아까는 앉을 때 이걸 잡고 이렇게 앉았고 지금은 앉을 때 마지막에 이렇게 하는 거예요. 이 동작 하나하나가 괜히 이게 본인은 아무 의미 없이 하지만 볼 때 보면은 아까는 이렇게 내려가고 지금은 내려가서 이렇게 하고 지금 어때요 지금은? 그럼 또 맞자. 자, 원장님 설명해 주세요.
Yeah. So Mr. Moon is applying more tips on the tailbone area.
가만히 있어. 그래야지 한 방에 끝내지 한 방에. 한 방에 끝내네. 됐어. 걸어보세요. 아주 가볍게 가자. 가볍게. 빨리 걸어요 빨리. 엉덩이가 많이 들어왔네. 자, 다시 한번 갔다 오세요. 보세요. 자, 저기 벽을 보고 서서 보세요. 저쪽에 가서. 양발을 모으고 찾아가세요. 양발 모으고. 자, 이제 뭐를 확인하냐면은,
오른쪽이
요 끝하고 요 끝을 확인하는 거예요. 어떻습니까? 조금 차이 나요, 아직도. 아직 좀 차이 나거든요. 이거는 이제, 이쪽이 올라갔고 이쪽이 내려간 거죠? 이거는 이제 볼륨에서, 여기 볼륨 안 붙였잖아. 자, 여기를 찍어보세요, 여기를. 어때요? 차이가 없어요? 차이가 없어요? 지금 이러면은 이 따님이 어머님 이리 와보세요. 이 따님이 생식기 쪽에 무슨 독소가 되게 많아. 분명히 생식기 쪽에 문제가 있던 사람이에요, 이 사람이.
밥을 너무 많이 먹었어요?
뭔지, 그건 제가 뭔지 몰라. 근데 생식기 쪽에 독소가 잔뜩 쌓여 있어요.
항암 치료했어요?
예?
항암 치료?
항암 치료했다고? 무슨 항암 치료했어요?
그 단백뇨가 나오니까 키드니가 망가져서.
지금 따님이
아 그러면 아니
네.
그러니까 면역 억제제를 먹으셨다는 거예요? 면역 억제제요?
아니 항암 치료.
영어로
Okay. Your mom just told us that you had chemotherapy in the past. Is that true? Okay. Were you diagnosed with any type of cancer?
No, it's just shut down my immune system because
Oh,
my
okay.
immune system was fighting. It was attacking my kidney.
Okay, so you used a very strong immune suppressant?
I did chemotherapy.
Oh, chemotherapy. Okay.
Cytoxin.
Okay. Helen mentioned that she had chemotherapy because of her severe autoimmune response due to the lupus. When was that?
Last year.
Last year. Did you have any side effects during the chemotherapy? Okay. What symptoms did you have?
Hair loss,
Okay. Hair loss. Anything else?
depression,
Depression. Did you have any nausea or vomiting or any digestive
vomiting.
issues?
vomiting. I couldn't eat.
Okay. Helen, it's been about 10 minutes since we placed the tips on her foot, and we had her walk around to stimulate the points even more. So at this point, Helen, how is your tailbone? Let's say if we started at 10, the tailbone started at 10 originally, how much is the pain now?
4.
So there's a reduction of about 60%. Yes. So can you try standing up and see if stand up and then just sit down again. So when you're standing up and down, are you noticing more tailbone pain? More pain when you try to sit up and down? Okay. So what we're going to do, we're going to add some points on her chin, and then point on her forehead. This point here is called Yintang. This point here, Sinjang, is called REM 24.